Hi, I'm Dr. Lisa Meek, and I want to thank you for joining us today for our talk about lasers. Here at the Parker Clinic, we have a lot of lasers. I like to say if it's worth having, we have it. And that's thanks to Dr. Lydia Parker, who has the foresight and continued thought of keeping us at the foremost edge of where laser technology is going. So let's get started with what's tried and true and what's new.
So now that we're live, I'd like to say a lot of you, this is the first time you're seeing my face without a mask on if you've already met with me. And here we are. So when people come in asking me about lasers, what should I do? The first thing I'm going to look at is what's your skin type? Because lasers are not for every skin type. If you have very fair skin, almost every laser will like you. But as there's an increasing amount of pigment in your skin, we're going to have to be more thoughtful and careful about your skin, because the more melanin in there, the more the lasers can pick up on those type things. And we want to be careful. We do not want to damage skin. I'm also going to want to know, have you had problems with pigmentation before, as far as hyperpigmentation or melasma? Because it's not a no to doing lasers. It's just that we have to be very careful about how we approach the lasers before and after care. So that's the first thing where we start. And then I want to know, what are you looking to improve? Are you looking to improve the fine lines? Are you looking to improve the pigment? Are you looking to improve the redness? No laser really does all of those things perfectly. Some we can do in combination, and some do all of them somewhat well. And again, then we have to look at, what's your price point? What can you afford to do? What amount of downtime can you have? And what are the risks that go along with that? So I will usually start with looking at the patient and talking about, if you're talking about fine lines, improving the texture, firmness, all those type of things, I always talk about my strongest lasers, and those are the CO2 lasers. They have been around for quite some time, but they have evolved to the point where the downtime is less, which is great, because that's what people want. People do not want to stay in their home for 4 weeks because they look like a burn victim. It's just not what we want to do. You may get some really amazing results, but it's just not realistic in this world. The CO2s that we have, and we actually have, oh, wow, we have 4 CO2 lasers now. I told you before, we have a lot of lasers. We have 4 CO2 lasers. We have the original CO2 repair, and then a lot of them have now changed to a slightly different mechanism of action, but still a CO2 laser. What makes that a superior laser when we're talking about, again, lines and collagen building and firming and tightening, is it's what's called an ablative laser. Whereas most lasers do what I call controlled damage. This is actually taking out part of the skin. It's ablative. It is removing a certain level of skin, but these are all fractionated now, which means there are lots of little dots of lasers that are going all over the skin, creating these holes that will heal themselves, because there's surrounding skin around that can help it heal. That's why the downtime has dropped dramatically. Some of our newer CO2s also cauterize, which is really nice, because if you remember the old CO2s, if any of you did that, it was kind of messy, a little bleedy and leaky for a while, and you had the Vaseline on you, and it was just not that great, even though the results were good. It was just not pretty. So like some of our newer CO2s, like my Fraxels, and we have the Core, and we have the Alma Hybrid, these newer CO2s, the downtime is slightly improved, and the messiness is not as great. For me, I put a little silicone shield on my patients that they use 2 to 3 times a day. They wash their face with gentle face wash, and they're really not having to come in as often to get that Vaseline and all the stuff that accumulates. So it's made it a much more aesthetically pleasing healing time. But that being said, you're still going to have a week. If we're doing a face and doing a strong one, you're going to still have a week that you are not probably going to want to leave the house, unless you're me, and I don't care. When we do under the eyes, we have to do it slightly less strong because it's thinner skin. Same thing with the neck. We have to be thoughtful about where we're doing it. So those type things do change somewhat on the healing time. But so the CO2 remains the biggest and the baddest laser I have, okay? The next group of lasers we'll talk about is Fraxel, because Fraxel has become one of my favorite go-tos. And we have a couple that are very similar to Fraxel as well, and there are a lot out there on the market, but the Fraxel has, in my mind, has always been the gold standard. When I first started doing lasers, way back, everyone would do an 8-pass Fraxel, and could do it every 2 weeks. But an 8-pass Fraxel meant we had to do a lot of numbing, lidocaine injections, blocking. It took a long time, and your swelling was significant, really significant, almost as much as doing a CO2 without the same results. And it just really didn't fit into people's lifestyle, and started backing it off. I started naming these things differently. I started calling a 4-pass a fast Fraxel, and then what we've mostly evolved to doing right now is a 2-pass Fraxel. Surely you're not going to get the same results as you do with an 8-pass Fraxel. But that being said, it is such an easy downtime, and we have you come in an hour earlier and do about, the numbing with that. And then in about 10, 15 minutes, I'm done with your face. It does still sting a bit. I'm not going to say it doesn't hurt all, but it's doable. People are willing to do that. They can fit that into their lifestyles. They'll leave here being pink, a little puffy, and that will last a day or two depending on their skin type, the sensitivities. But you can put makeup on that day, and you can go on, and most people won't notice that you've had it done unless you say something. And so people, myself included, except I don't get to do it as much because I want to go home some days, but most of my people will do them at least 2 times a year, if not 3 or 4 times a year, just to keep that skin woken up. Because as we age, our skin gets very lazy and it doesn't want to do what it's supposed to do. When we're young, the skin creates its own collagen and it just keeps the ball rolling so nicely. But as we age, it doesn't want to do that. We have to figure out ways to make it kick it, to make it build that collagen and keep that healthy glow. And that's where I found that 2-pass Fraxel to be really helpful. If you're doing an 8-pass Fraxel, it's $1,200. If you're doing a 4-pass Fraxel, it's around $650 to $700, and then the 2-pass is approximately $400, around about that range, depending. So it fits into most people's budget as a nice way. The Fraxel has 2 wavelengths, and lasers come in different wavelengths, and that's what changes what they can do. So the Fraxel has 2 wavelengths, and you don't have to remember this. It's 1500 is the one that builds more collagen and does help a little bit with pigmentation. The 1927 one is much more about pigment, and you build some collagen. And we can mix and match and go back and forth. And these are fractionated, so your whole face doesn't have a laser point on it. And it's just become something that has become very doable for my patients. In the same family, which I don't do a lot of, Dr. Woods does more of these, is what I call the baby Fraxel, and that's the clear and brilliant, and that's very similar to a 2-pass, very similar, just slightly different in what it does. But so there are different ways to approach that. The other thing when you're talking about, let's say you're more concerned about your pigmentation, sun damage spots. And I like to remind people that our skin has more than one type of pigmentation. We can have sunspots or freckles or whatever you want to call them that are truly just pigmentation, and that's from years and years of sun damage. That's where the melanocytes, the cells that produce more pigment, have, because of the sun damage, have kind of gotten on a different clock. And so every time they see sun, they want to make a little bit more pigment than the other ones who don't have, for whatever reason, the same amount of damage. When we're just talking about pigment, lasers work great on those. The Pico is a laser that is very good at targeting in on that pigment, breaking it up. The downtime is very minimal with that. You'll leave here where the brown spots have been treated a little pinker. They may lightly flake to a little bit heavier scabbing with pretty quickly healed skin, and you can put makeup again that day. So it fits a lot of people's lifestyle. Anytime we're doing any laser, just let me say now that you really have to be careful about the sun. 2 weeks before, 2 weeks after are periods where you should be very thoughtful about the amount of sun that you have, because again, the lasers are attracted to pigment, and you can increase the damage or you can trigger excessive pigmentation of your skin. When we do that, any of the lasers that we're worried about increasing the pigmentation risk, we will put you on a protocol possibly before and definitely a protocol afterwards. I started doing this a few years ago where I would give people hydrocortisone for a week after laser along with a hydroquinone. And hydroquinone was continued for about 4 weeks. And we saw very little of the PIH inflammatory pigmentation and less concern about managing that with it. So that's changed a lot for us. That's helped us out a lot. So that's the Pico. And generally, if we're talking about the face, it's around a $500 treatment. It can be more, but that's generally what you're talking about. The next type of laser that we have that I do like is the Resurfix. Now, the Resurfix laser is very much like the Fraxel, slightly different wavelength, but very similar to that. And we can use it exact same way. The difference is that it's more of a stamp laser versus the rolling laser, which I like for a more overall general. But what I like about the Resurfix is when I have discrete scars or a specific scarred area, I can really hone into that very nicely. And stretch marks do very well with it as well. And so that's become my more go-to when I'm looking at a smaller area or a specific area that I really want to take care of. But again, it would work just as well as the Fraxel. You would still need numbing and you're still going to have downtime. It's going to be pink and swollen for a little bit, but very much in the same family on that. Again, it depends on how much area you're doing. I would say roughly a full face can cost up to $1,000, depending on the strength that you're doing, and $500 or even a little less if you're focusing on a specific area. The next laser we'll talk about is the intense pulse light. That is technically not a laser, but close enough. We use basic wavelengths to treat, and we can change those wavelengths if we want a little bit more red improvement, a little more pigment improvement. The IPL has been around for a very long time. It started really the generation of what we can do with skin. And I like to call it more of a generalist because it can help you with pigmentation. It can help you with some redness that you might have from a rosacea or even photo damage, which can cause redness. And it's not one of my more difficult lasers. Most people can get through it pretty easily. Feels like a rubber band snaps going on, and we go over the whole face. There's a gel on your face first, and then the crystal that filters out the wavelength. We flash it. It's very bright. That's probably the most disturbing thing. Even though you have eye shields on, the brightness is what makes people feel like they're jumping, just from the reflex of that, which they're not. They just feel like they are. And so the IPL is a really nice thing, particularly I think for someone in their 30s or 40s that has had a little bit too much sun in their time, but their skin texture and as far as lines and things are doing well, but they just want to clean the skin up a little bit and improve the tone of the skin. I think the IPL is a great thing to throw in. I know lots of people on my staff would line up outside the door and say, anytime you want to do an IPL, I'll be there, because it just is an easy one and does some nice work for it. We also have the V-beam. A lot of you may be familiar with the V-beam because you're coming in for your bruises to be treated. But the V-beam is great for general redness and for where you see what are called broken capillaries or spider hemangiomas or the cherry spots, anything that has that redness to it. That's what this laser is attracted to. It can cause bruising. It will cause welding and redness, but that's the king really of improving when we see redness areas that we need to improve on. We also have another laser called a YAG laser. You don't need to remember these, but and that's good for where you have bigger vessels, not the fine ones, but the bigger vessels. You can use it on the legs. But what I really like it for, and I need to treat one, is where on my own, which I have, where you get those kind of blue ropey veins through here. We can actually treat those. We're not getting rid of them, but we can shrink them so they're not as obvious. Sometimes you'll need 2 treatments. Sometimes one will do it and you won't need to treat it for a while. It depends on how close you want to get to your eye in terms of what we need to do. Most of the lasers we do with adhesive laser shields that protect your eyes from the laser, but we can only work on where as far as bone, because we need to protect the eye. So if I can move this down with my laser shield on and I can still have the laser touching the bone, that's as close as I can get safely, and that's more than safe. But if we want to go closer to that lid line, we have to put in what are called internal eye shields. Basically, they're metal contacts that we have so that we can be right at the eye and we're not going to damage the eye itself in any way. And it's safe to do that. It's just a little bit more finesse and a little more work. But that's a way that you can get closer to the eye. Even when you're doing a CO2, you might want to, just put those in so you can get closer into there and improve the area where we see fine lines becoming more problematic. And those are basically, in a nutshell, our lasers. Like I said, we have a bunch all in the same categories, but those are mostly the groups that we have. So what you really need to think about when we talk about that, or you have questions about it, is what are you wanting to happen? What is the action that you're looking for? What are the benefits? Besides this, will I also get some collagen building? What is it going to contribute to me? What are the costs? Because not all these things fit in everyone's budget, but it doesn't mean there aren't things that you can do that will be very, very nice for your skin and do some really good improvements on it. And then the other part of it is, what's the downtime? What fits your schedule? And that's always an issue, and we try to respect that and understand that and figure out how we can make this work for you. But the downtime is important, and we do understand that. You want to know the risk. Most of the time, the majority of the times, these things go great, but we wouldn't be telling the truth if we said, oh, nothing bad can ever happen, because they can. These are significant energy devices. We should know how to manage these well, and if there should be a problem, we should know how to manage the problem for you. But everything has some risk, just like Botox and fillers. Nothing comes without any risk at all. And we try to always be upfront about what your particular risk is and how we would manage it for you so that you could get the best outcome from that. But as a whole, these lasers do very, very well. It's rare that we have any significant problems. Sometimes there are a few minor things that don't take long to fix, but it's pretty rare that we get into any problems with these type lasers. I think that's the end of my spiel that I usually do when I'm talking with a patient when they're coming in for a consult. So is there anything else that we can talk about for you guys? So somebody's asking about Tixel. I have not heard about Tixel. There's a new thing coming out all the time. Nina, my fancy girl here, is going to check on that for us while we speak. Can any of these lasers be used on the neck? Yes. Everything that I talked about can be used on the neck. But again, we modify what we do because it's thinner and the healing time. Everything heals faster here and slows down the healing as we go down. And what I didn't say, what's new in lasers. Okay, the one thing that I did want to mention is I haven't seen a lot new things in lasers, different ways it's delivered, but not a lot of new. But what I think what we're seeing is this blending of things, and we're seeing a lot of devices that come with the radio frequency and the CO2 laser, where you do the tightening and then you CO2 laser on top, which is great. That's amazing. Or you can Fraxel on top of the radio frequency devices, or you can, like the Alma hybrid, where it's a combination of the CO2 plus a Fraxel type lasering. So what we're seeing now is a combination, where before we did them singularly, we just separated them out and that's what we did. But what we're really seeing a lot more combinations, and I think it's a good thing. I really think it improves what we can do. As far as elsewhere on the body besides the neck, I love Fraxels on the arms to clean up some of the pigmentation, improve a little collagen. I love it on the chest because chests get heavily photo damaged. I'm not a fan of doing an IPL on the chest because I don't want it to look uneven, whereas with the Fraxel laser, I can make it all blend in really nicely to help with the collagen and to help with the pigmentation, improve the evenness of the skin tone. So for that, lasers are great for scars, be they red scars, that's where my B-beam comes in. Depressed scars, that's where my resurfacing lasers like the CO2, the Fraxel, the Resurfix, that's where we can make scars improve and look better with that. Same thing on the abdomen. Like I said, stretch marks. I think the Resurfix really does a nice job on stretch marks, but I do like to remind people there is no magic eraser for stretch marks or even scars. We can improve them, but we can't take it back to a zero. But they do really a nice job with it. We're doing less and less of the bigger vein lasering because the sclerotherapy, particularly Dr. Kiesel here, does such a great job that we sometimes do a little bit of cleanup for him, but I see less need for that because of the sclerotherapy that we do here at with Dr. Kiesel. So what is the downtime for the B-beam? Well, it depends. And a lot of time I'll have that conversation with my patient because how much downtime do you have? When we're working on redness for rosacea or photo damage, obviously the stronger I do that, the better your results will be. But that may also result in some bruising. And depending on how deep the bruising is, the bruising can last for a week. And unlike bruises that may come if we do an injection and you have a bleeding bruise, you cannot unbruise a B-beam bruise because their mechanism of action, how they occurred, are different. So I can't go over the B-beam on a bruise that I created with my bruise. So if you tell me I can't be bruised, do what you can, but keep it in the line where it's not going to be bruised, then we adjust them down. You will be welted for a day or two, no matter what we do. Most of the time, unless you say something, nobody else really notices, especially if you're going to wear makeup. If you start saying, oh, can you see how welted I am? Yeah, then everybody's going to see it. But for the most part, people don't see it. It's really unavoidable. I mean, it's avoidable to really worry about it. There's a question now about the fibroblast pen. And so the fibroblast pen, we do have a very similar type product. I find them a little less precise. I think you have to be very, very careful with them. When used on a lighter setting, they can be great. But if you really do it on the maximum settings or not even maximum, I think you have a greater risk of having actual scarring because there's a lot less control in that respect. So on a light level, I think they're great. But if you start looking to get the same results as you're going to get with a laser, you should be very careful because I think you can end up with some damage to the skin. What's best for acne scars? Well, I'd like to look at the scars first because I have to say, I have found, and we can laser away, and I do that with a lot of scars when we're talking about the depressed scars. If they're pink or purplish red, we definitely want to V-beam. We want to get that color out of them. The reason they have that color is anytime you have a wound, and some people will wound differently than others, but your body's just trying to heal. It doesn't care how it heals. So it's a disorganized healing in terms of the small red blood vessels and things that are being created in there. Once it's healed and the skin's all intact and everything's back, the body has no reason to get rid of these leftover red blood vessels. And so they stay there. And that's why you can still see the scarring. So with the laser, the B-beam laser, it is attracted to them and destroys them so we can get that discoloration out of them. After that, then we consider doing the resurfacing with the CO2 laser, the Fraxel laser, or the Resurfix, depending on how many they are, where they are, how much downtime you have, what you want to achieve. But I've also found that for myself, for my patients who are coming with scarring, sometimes I can get really, really nice results with just a small amount of filler into those with my Bobella or some other fillers. And it looks great and it lasts a long time, and it's just less of an issue for them. So it really depends on the scars, but all of them work depending on where you're trying to go. The new hybrid laser, there are lots of hybrid lasers. I think if you're talking about the Alma hybrid, that one is basically a combination of a Fraxel type laser with a CO2 laser. You can separate them, so you can all do all CO2 and all Fraxel type, or you can combine them together. So it's laying different depths. And as I said, the CO2 is a ablative, so it's taking out some, whereas the other is more of a controlled damage. You can do what's called a paint, where you just lightly go over the skin, which is, in my opinion, is similar to like my little 2-pass Fraxel. They all are going to have the same amount of discomfort depending on how strong you do it. So if you do it lightly, it's going to be much more tolerable. The stronger you are with the laser, the more discomfort you have, and the more we're going to have to do pain management. So that's the hybrid laser that we have here in the office. And like I said, it's just a combination of the technologies that we already have. So what is the best and safest laser for lines under the eyes? And what about the lip area? Those are the two areas that I think we really don't focus in enough until it's kind of getting a little late in the game, because you do not want these lines to get etched in, where even when you move the skin, they're there. So the earlier you manage those lines, these lines, I always say there's 3 things for these lines. You can do A, B, and C, or A or B or C, or whatever you want. But one of them is a little bit of Botox there, so you're not creasing as much, like that. When we talk, drink through straws, all those things, repetitive movement, okay? The other thing can be some of our fillers. When we do the fillers, we do not want to blow this whole lip platform up like a balloon so that, yeah, there's no wrinkles, but it looks awful, you know? So we do fine fillers in that area to help with that. And then the resurfacing. I happen to think if you want the best, you go to the CO2. I think that really is the best. How often can you do that? I will never do a CO2 more often than every 6 months, because when you're doing a CO2, your collagen building, the bulk of the improvement will happen within the first 4 months. Okay, but it will continue to improve up to 6 months. With the other lasers we're talking about for collagen building, the bulk of it is done at 3 months. As we age beyond that point, then our own collagen that we've built is starting to age, and it may be time to renew it with a non-ablative. With the CO2, you do not want to push that skin too hard. You want to make sure it has time to heal. But that's as often as I will do it. And for the most part, it's rare that we do it every 6 months. Most of the time, it's maybe once a year, maybe every 2 years, maybe every 3 years for that one. And I'm going to say the same thing about the eyes. With the lasering, as far as what's best is Botox where you can, fill where you can, and laser as well. And again, it depends on how much downtime you have. If you can handle having downtime, then go for the CO2, because that's going to give you the best results. Are the Restore and Resurfix both a type of Fraxel, or is one a CO2? Both of those are a type of Fraxel. So the Fraxel Restore, that's a trade name. And the Resurfix, both of those are in the wavelength range of 1550, around about there, slightly different. But yes, so neither of those is a CO2. I hate the fact that so many of these lasers have the same name. We have the Fraxel, we have the Fraxis, we have the Fraxel Repair, and it becomes very confusing to patients. But a Fraxis is a CO2 if you're talking in our office. A Fraxel is the first one I talked about, the Fraxel laser that we're doing 2 passes on. That's what that one is. So I hope that answered that question. Do we offer broadband light? That's very similar to what the IPL is. That is the gold standard. BBL, IPL. This is where it is, and I think the IPL is actually superior to the BBL. I'm sure if somebody has a BBL in their office, they're going to think there's a superior, but I do think the IPL is a better quality. Can the lasers help with dark circles? Yes. Okay. For 2 reasons. One, you will have some collagen building, so it depends on which laser, because that thinness, that darkness is for several reasons. Some of it may be hereditary, and that can be a lot more difficult to take care of. Everybody has those deep, dark eyes. Some of it are the changes that happen over time, where the architecture of our eye socket actually changes, where the bone may have been up higher, the bone starts becoming less here, it is resorbed, and so we have more of the bags coming through, and we also don't have the support, and you oftentimes will end up with I call it ditch. Okay, and I don't care how much cover up you put on, you cannot hide a ditch because it is a light problem. All right, and so that's where filler would be most helpful. But the other part of the darkness that we have under their eyes is that the skin is very, very thin here, and underneath that skin is a very thin muscle, and that muscle has a darkness to it as well. And then the other reason is there are a lot of veins through here. So if we use our YAG laser through this area, we can shrink a lot of those veins so they're not as, some of them not as prominent, but also even if they're not prominent, it's the complex of them that is creating that darkness. So with a combination of things, we can improve it along with using a hydroquinone or a pigment reducing program if there's also pigment that's adding to that. So yes, we can help with those dark circles a lot. What about seborrheic keratoses? Can they be lasered away? Not very well in my experience. I've tried. I just don't find that even with the ablative lasers, because we're using them in a fractionated way, I haven't found them to be that great at helping with seb cares. I've tried, truly, I've tried everything that we have multiple times. I think still the best thing is being very careful with, very careful with liquid nitrogen. Less is better. Softening them, improving them. We don't want to leave marks from our liquid nitrogen, but because the seborrheic keratoses are not the same as just pigment, they are actually a small growth on our skin, they typically don't respond as well to the lasers. And so oftentimes when I have people come in, I'm actually separating out on their skin and saying, listen, these are great, the laser is going to respond to these they're not, and we're going to have to do a little liquid nitrogen. Unfortunately, the liquid nitrogen does have a little more downtime, but if you look cost effectiveness, you know, there's no question that liquid nitrogen is better. Again, it has to be done very lightly so that we don't create problems. What is the best laser treatment for aging skin with some spots as well as removing wrinkles? You know, if you can handle a CO2, I think that's great because you're going to get brown improvement, you're going to get fine line improvement, you're going to get everything you want, okay, with that laser. But there's downtime. If you want to, you can do combinations. Let's say you want the brown spots, but you also want some collagen. You can do a combination of the Fraxel where it had doing some of the pigment and some of the collagen, or you can separate out with just the Pico and some of the Fraxel, so you can do combinations. But ultimately, I think that my best laser is still the CO2, but again, it's a little tougher because of the downtime and for the cost. What's my opinion on threading for the face? Well, I do the threads. I've tried both types of threads. There's the Nova threads and the silhouette lift threads. The Nova threads, the smooth threads, they're fine. I don't think they do that much, but you're not going to get into trouble with them. I don't like the Nova threads with the barbs. I found them unpleasant for the patients. They didn't always do as well as I would have liked. And when the silhouette lift threads came out, I couldn't wait because I knew that there had to be something better. I do like these threads a lot better, but they're not for everyone. They're not, you know, they are not the same as a facelift. If this is what you want, then you need to talk to a plastic surgeon. But they are a nice way of approaching the face without using fillers and overfilling. It's a way of shifting just a little bit and lifting. And because of the type of material used, it actually stimulates collagen. If any of you use Sculptra, it's the same material as Sculptra. So you're generating collagen in almost vector process, and also doing some physical lifting as well through the mechanism that they work. And these are through here, and you can do it through here. So those are options that you have. I were to get the fibroblasts, could I later get something else? Yeah, you can always do something else. You know, just because you did a Fraxel doesn't mean the next time you can't do a Pico, or the next time you can't do this. You're never locked into anything except making sure that we're respecting the healing time of what you're doing. And so really you want to switch on to something else. So yeah, we mix and match these all the time. So that's never a problem. We do not have a halo. VBL, IPL, in my opinion, there's not much difference. We don't do a halo because we have so many lasers that duplicate a lot of these things that there's just been really, we've never found a need for the halo. It just hasn't really fit any niche because what we do works well for us. What's the best treatment for scars and bruises on the legs? First, you want to know why are you having the bruises. If it's skin that's thinned with age, and it's more fragile and you have a lot of bruising, we can do our B-beam on it, but we have to be very careful because, again, it's very thin skin. We can't have too much energy absorption because you can actually have breakdown in the area because it's such thin skin. So it depends on the quality of the skin. If you have a lot of venous insufficiency and swelling and things like that, I'm less likely to want to do that because it may create a wound that's going to have a longer time to heal. As far as improving the quality of the skin, particularly thinner skin, I do think doing some things to the skin to build collagen, very low level Fraxeling or things like that to help build the collagen. But again, it's a very thin skin. If you're having to the point where it's bruising easily, that we want to make sure that we don't cause breakdown of the skin by the energy. So it would be low level on the arms. It's great. On the legs, again, it can be done. It starts getting a little more costly with it. When we do our lasers, we're usually using a very strong topical solution ointment on the skin. And because it is a very strong topical ointment, we don't want any of that absorbing into the system that can actually cause toxicity. So when we do it, you may say, oh, I want to do all my arms and here. And we're going to tell you, nope, you can't do that because we have strong numbing ointment and it's too much for you. So generally I tell patients it's an 8x10. That's how much I can do with the stronger lidocaine treatments and no more than that at a time because we want to make sure we're careful when we do it. Can these be used on radiated skin? Yes, as long as we feel that the skin is well healed, and we're going to want to look at it first to make sure there's not a lot of atrophy and the quality of the skin. So it's an option, but we're going to want to look at that very carefully and make sure we're in the period where we're not going to cause any damage to that. What is the benefit of adding PPR to Fraxel Restore? So some of my colleagues love PPR. I am PRP, excuse me. I am not as big of a fan. PRP has been around for 10 years. There are better collection techniques and everything. I think it's great for hair loss for women. I absolutely believe in that. I think the added cost that comes with PRP when you're using it with lasering, to me, it's just not cost benefit. It may help you heal just a tiny bit faster, but that's just my opinion. I know some of the other doctors do like doing it after that. I just try to keep the cost what will fit a patient's budget, and so I'm less likely to use that. So if someone's not sure what procedure, should they make a consult? Absolutely, because everyone's skin is not the same. We're all of our doctors here use the lasers. We're all familiar with them. We are always going to want to see you first to make sure that you are getting the right laser. That doesn't mean that you can't come in well prepared. I love patients who've come in well prepared. Well, I've read about this and heard about this, and I was thinking about this. That's great. I will work with you. We'll talk about what you read, what I think is right, what I think is maybe not perfect, but close. And based on that, we can come up what is the best fit for you. I think there's a lot of information out there, and I love that there's information out there. But sometimes I look at TikToks and I look at these other things, and you see them, even our brochures that we have, they're always going to show the best of what happens, the best of it, and it's all going to look like magic, because they can filter those things out. Whereas we live in the real world, and what can we expect to achieve versus this unrealistic portion of what people might think that they can get from these. I always say when people say, can you fix this? And my answer is always, I can improve it. I'm not going to fix all of it. I can improve it and improve it. And I'll tell you, can I improve it approximately 50%? Can I improve it really great, close to 100%? I'll always be honest and tell you, because that's important. If you have PLE, can you have facial laser done? I would leave that for my derms, because I haven't had that cross my table at this point in time. I would imagine that we can, but I would want to cross-reference it with one of my derms to make sure we would be okay. Are you ever too old to use lasers for wrinkles? You aren't. Again, your skin, the older you get, the less responsive your skin is going to be to these collagen building type things. But they are still going to do things, whereas the CO2 is always going to do something because it's ablative. But the collagen stimulation as we get older may not be as great. And that's the same for radiofrequency and the lasers. You may not see the same amount of gain as you would. And when I say older, I have to qualify that because, I'm 63 now. But anyway, I really think that, late 60s is when I would say you really have to, and again, I'll still be doing lasers then. I'm knowing that I may not see quite the same changes that I would have for collagen building that I would have otherwise. My brown spot lasers, my vascular lasers for redness and those things, those are still going to work great. It's just the skin as it ages can't quite do the same things that it used to do, no matter what we try. What is the best for age spots and sun damage on your hands? I think a combination, because a lot of those times that they are not just pigment, sometimes they are those seborrheic keratoses, and it can sometimes be hard to define which is which. If you're good at looking at them, you can kind of see there's slight difference with the subkerats, even though they may be flat. If you look at them with good light, you see that they're not quite the same as the skin. They have a little smoothness. They don't have those textured lines that skin has. And those are more often the seborrheic keratoses, or in the family of seborrheic keratoses, whereas the pigment, which the lasers love, will have those fine lines that you see on skin. You can see that, and it's just because there's pigment below that. So again, I would look at that if we want the skin to look better. If that's the biggest concerning thing, then I would probably do a combination of a pico plus a little liquid nitrogen on them, a very light liquid nitrogen. You may have to come back for a second treatment when it's all healed. But that to me has done really, really nice results for the majority of my patients. How long does the Alma hybrid treatment take? Well, it all depends on what you're going to do. So if you're doing it at the max, where you're doing the combination of the Fraxel type laser with the CO2 laser, you're going to need some numbing on there, and it's going to take a little while for the whole area to be treated. So estimating 30, 45 to even an hour may be necessary. If you're doing a partial area, the numbers go down. The lighter you do it, the quicker the laser can do what we need it to do. And so the treatment time will go down with that. So that can make a difference when that. Would I recommend Botox filler prior to CO2? It depends on how much time and when you're doing that. Botox, you can do it before or shortly after. I'm one of those people that believe that when you're creasing and we're going ahead and actually trying to improve the fine lines, particularly the ones that are related to creases, you might as well have that collagen learning to go this way than trying to follow it this way. So the Botox, in my opinion, can be done before, can be done shortly after. There is really no time that you can't Botox, except I won't do it that day or that week. Okay, that's the limitation. The fillers, I've become a little bit more cautious with my fillers because it's taught me that there's a lot of activity going on under the skin. And so for some of my more superficial fillers, they may create a reaction to the filler, and we don't want that. That's never good. The deeper fillers are probably going to be fine. And if you've already had deeper fillers in your face and you want to do the CO2, they're going to be fine. So you don't really have to worry about that deeper filler where we're really going into the down to the deep planes of the face, deep fat pads, or down onto the bone. Those areas you're fine. It's where the superficial fillers, I will actually not do my superficial fillers on those until about 5 to 6 months after that, and then I can go in and contribute to what we've been able to achieve. How often would you recommend the 2-pass laser for best results? Ideally, every 3 to 4 months. I think that would be great. Lots of my patients do that and they like it. It's a easy thing, and people notice their skin looks nicer. It has a little more glow to it. And it just, like I said, it just wakes that skin up so that it's doing its job. Will any of these procedures help to reduce enlarged pores? Yes and no. So the no part is we're all born with a specific pore size, and some people are blessed where you don't see a pore on their face, and you never will. And other people have what would be considered average pores, but as we age, those pores are surrounded by collagen as a support, and as that support is lost, they kind of flop open. Okay, and so they look larger to you, and they are a little larger because they're just not, the surrounding area is just not firmed up. So I love doing the Fraxel for that, but any of the lasers I was talking about for the CO2s, the Resurfacing, any of those that are going to be collagen building lasers will help with the pore size, as will making sure you're using a tretinoin or retinol that keep the oil glands down so that it's not producing as much sebum and that on the skin itself. So yeah, we can help with the pores. We can. Can you do an IPL type BBL on the arms to get out of dark spots? You can for localized ones, but again, you have to be very careful that we don't end up with a stripy look. And so I tend to more often would like to do a pico on those because it's definitely going to be a more even, or even the Fraxel, but you can do the IPL on there if that's something that you want to do. Can the laser be used on purple spots on the lips? Yes, if it's the purple spot that I think of. Sometimes we have occasionally on the upper lip, more often on the lower lip, we have what's called a Venus lake, and they're usually a dark purple, kind of almost like a little bubble that's there, and it's just basically a blood vessel that's just had a weak spot, and so you can see that. And I love treating those with the YAG laser because we can make them disappear, which is great. So that, yes, they can be very easily treated. How long do you need to wait for laser after having a PDT for actinic keratosis? Well, I'll tell you one thing I really like to do, and I've had patients who were having problems with just having one basal cell after another taken off, and it was just a problem for them. And what we started doing was actually combining their Fraxel laser and their PDT at the same time. And you do have a little bit more redness and a little bit more swelling, but it has dramatically improved how their skin is. I can tell you one woman, she hasn't had anything taken off for a couple of years now, and she still comes in once a year. I believe she'll do the combination again, but it dramatically changed the course for her and several other patients. The problem is your insurance company will not pay for your Fraxel part of it. So that would be the cosmetic part of it, that we would do that. And then you would also be doing the PDT portion of it. But so if you were all ready to do the PDT, generally, I would say, depending on how strong a response you have, because some people can have mild redness, other people can look very red and very swollen. I would say anytime after 3 to 4 weeks, you can go ahead and do a laser. If you've had a really strong reaction to the PDT, there's a plus to that because you're actually going to be stimulating some collagen as well, and maybe even getting some pigment improvement just because you have really kicked that skin hard. So I often will tell people if they're seeing me, but they also have the precancerous lesions that need to be treated, I'll often tell them, let's get the PDT done first, and let's see where we got to before we decide what the next laser should be. So what's the difference between a CO2 and a Fraxel? Again, it's the wavelength, and a CO2 laser is what's called an ablative laser. So it is actually putting real holes into the skin, taking out, like I always say, it's like Star Wars, that laser is going right through. In addition, because there's thermal energy, you are creating a stimulus for collagen. So it is the biggest and the baddest. The Fraxel and all the other lasers I talked about are what's called non-ablative.